hi, myself Pradipha here to explain with the topic administration of medications. Okay, before going deep into the topic, let's see what is a drug. Drugs are chemical substances other than food that change the structure or function of the body or mind, thus improve physical and mental well-being. Let's see what is a medication. Medications are drugs that are used to treat or prevent diseases and other conditions according to the needs. Let's see the rights of medication administration. All the medical personnel should follow these rights to reduce medication errors and harm. The first right is right patient. Here in this right, we have to identify the right patient by patient identifiers to ensure that you are giving the medication to the patient it is intended. For confirming the right patient to tell their name while you check their unit record number and verify their date of birth. Then check the patient history you have matches the unit record number on their wrist. Next is right drug or medication. Here in the right drug, the medical personnel has to cross-check the medication with the other medical staff that you are giving the correct medication that was actually ordered. Next is right dose. Here in the right dose, check that the order is appropriate for the patient. Too much or too little of a properly ordered medication can still causes issues for the patient. Next is right route. When checking the medication, it is important to check that the order meets the requirements as well and that the route is appropriate. Next is right time. Here is ensure that you are giving the medication at the right time and that two dosages are not stacking up on one another. Next is right documentation. Here we have to check that you are properly documenting the medication including the time, dosage and route so that you have the proof of what you gave to the patient. Okay. Next, we'll see the common drug preparations. First one is aqueous. That means the drugs dissolved in water. Next is caplet. These are tablets coated with gelatin. Next is capsule. These are drugs encased in a hard or soft outer case. Next is elixir. These are drugs dissolved in water, alcohol solution or sweetening agent, etc. Next is emulsion. These are drugs in which one liquid is spread by means of small droplet over another liquid or dispersions of fat globules in water. Next is enteric coated tablets. These are tablets coated with substances that blocks absorption of drug until it reaches the small intestine. Next is liniments. These are mixture of drug with oil, soap, water or alcohol that is applied on the skin. Next is lotion. These are drugs in liquid suspension intended for external use. Next is lozenges. These are drugs in sweet base that is released as the base dissolves in mouth. Next is ointment. Drug in Vaseline base that is applied to and absorbed by the skin. Next is poultice. These are soft, moist preparations that supply moist heat to the body. Next is suppository. These are drugs mixed in a firm base and shaped for insertion into the body cavities such as rectum, vagina, etc. Next is suspension. These are undissolved particles of a drug placed in a liquid. Next is syrup. These are drugs dissolved in a solution containing water and sugar. Next is tincture. These are alcoholic or hydroalcoholic solution prepared from drugs derived from plants. Let's see the route of drug administration. First one, oral administration. Here the drug is administered orally. Next is sublingual administration. Here the drug is placed under the tongue where it dissolves and gets absorbed. Next is inhalation method. Here client inhales fumes of volatile drugs. Next is injections. The application of drug to the skin with friction. Next is instillation method. Here putting a drug in the liquid form into the body cavity. Next is insertion. Here introducing solid forms of drug into the body orifices. Next is insufflation. Here administration of drug in the form of powder, vapor or air by using an insufflator. Next is implantation. Here putting in of solid drugs into the body tissues. Let's see the parenteral administration. Here the administration of drugs other than oral is called as parenteral. Here we can see the parenteral administration in detail. That first one is intramuscular injection. That means administration of medicine or injections into the muscles. It is slower than intravenous and is the second fastest absorption due to the muscular vascularity. Next is intradermal. The important or the major uses for intradermal injections are tests for allergies and diagnostic purposes. While injecting the needle tip can be seen through skin and inject slowly. Normally, resistances feel while administration. If not felt, the needle may be too deep. Small blood resembling like a mosquito bite should form. And do not massage after the administration. Next is subcutaneous. Here in the subcutaneous injection, the injections are administered into the fatty layer of tissue just under the skin. That is called as subcutaneous tissue, which is less vascular and meant to be absorbed slowly. Next is intravenous. Here, sterile aqueous preparations administered into the veins, relatively large volumes. The main aim of the intravenous infusions are used to extend blood volumes, provide electrolytes, nutrients or medications. Next is intraarterial. Here, the medicines are directly administered or injected into an artery. Intraarterial injections are only utilized in special situations and given by specialized physicians in the cardiac catheterization lab or interventional radiology. Next is intracardiac injections. Here, the drug is administered directly into the heart. This is mainly used for calcium salts as a calcium channel blocker. Next is intrathecal injection. Here, the injection is directly given into the spinal cord or injection into the spinal canal or subarachnoid space so that it reaches the cerebrospinal fluid. Mainly used for anesthesia, chemotherapy or pain management applications. Next is intraosseous. This is the process by which injection is directly given into a marrow of a bone. This mode of injection is mainly advisable when intravenous access is not available or when contraindicated. And last one is intraperitoneal. In the intraperitoneal injection, the medication is administered into the peritoneal cavity. Okay, thank you.